Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. We'll get an Arkansas COVID update in just a moment. First, to the surprise of no one, if to the dismay of two other candidates, Sarah Huckabee Sanders has formally entered the race for governor. She joins Lieutenant Governor Tim Griffin and Attorney General Leslie Rutledge on the Republican primary ballot, though we would note the ticket hasn't closed. Meantime, the man who'll remain governor another 2 years is dealing with intra-party GOP rivalries with the legislative session in its earliest days. So to kick it all around, Andrew DeMillo, Capitol Bureau Chief of the Associated Press, former Republican State Representative John Burris, and Ark Monroe, a Democratic activist who has worked with 4 Democratic governors. Gentlemen, thanks for coming aboard. Andrew, why don't we start with you? Really anybody, but Andrew, in the news business, and for that matter, the political business, Sarah Huckabee Sanders has dominated the week.
Yeah, that's correct, Steve. This was widely expected that she was going to run for governor. It was just a matter of when, not if, she was going to announce her candidacy. She did so on Monday with a nearly 8-minute video that kind of gave you an idea of where this campaign is going to go and probably where this primary is going to go. This video where she embraced former President Trump and his rhetoric in a lot of ways too, by talking about protecting Arkansas from the radical left, kind of going through the laundry list of targets that the president has had, including Alexandria Ocasio-Cortez, the media, the Green New Deal, socialists, and this is all while he's facing an impeachment trial for inciting the deadly riot at the U.S. Capitol, and kind of gives you an idea of how much she is going to lean on him in this race. And we saw that even hours after she announced her candidacy, he endorsed her, and other Trump figures have also endorsed her too. So this really kind of sets the stage for what's going to be highly nationalized race, probably unlike anything Arkansas has seen before.
Yeah, Andrew, John, as Andrew noted, the suspense here had become bearable.
It had, and it's a small state. It's a small state of Republicans, and so I think most people in this circle, expected Sarah to announce, and it's going to be interesting and tiresome at times. I mean, I think all 3 candidates that are announced have their own niche, and I think in a way that's good because oftentimes primaries or elections in general just become pretty boring. This one's not going to be boring. Sarah has a national profile. I think those that know her as a nice person, easy to work with over the years. I've worked with her some. Lieutenant Governor Griffin has been a thought leader and policy leader in the state for a long time on things like income tax and others. And then, Leslie Rutledge is the incumbent Attorney General. I think she's got a good reputation of working with the legislature, hires great people, done a good job running the office, and that matters when you're asking for a promotion. And then, as you alluded to, there's other candidates like, Senator Hendren is talking about it, and he's been in state government a long time. And a lot of times state government is more about nuts and bolts and boards and commissions and agencies and things like that. And no doubt Senator Hendren has experience there. So I think they're all going to talk about their own uniqueness, and they all have qualifications, and it's going to be a very long, expensive primary for Republicans in Arkansas.
John, it took Mr. Griffin, I think, a matter of hours, if not minutes, to send a barb Ms. Sanders' way. So you termed it interesting. It could be a little bit more than just merely interesting, could it not? It could be bloody.
Yeah, it took a minute, and that's about 30 seconds longer than I thought it would take. I mean, they were all ready for what's going to happen, and I think that's going to be the theme. And look, I mean, in a lot of ways, I think elections are fine to contrast. No one likes negative, no one likes false attacks. Contrast is different. That's fair. I think all these candidates have things that are positives, and they're going to spend time talking about what they consider to be weaknesses of their opponents. And I think that's why it's going to be a long primary.
All right, Ark Monroe from the center left. Your take.
Well, this race kind of shaping up like an old race back in 1970 when Winthrop Rockefeller was trying to seek a third term, and there was a full Democratic field for 7 or 8 candidates running for governor. And Dale Bumpers emerged from that pack in a runoff with Orville Faubus. And in a way, Orville Faubus was trying to run the race that he had run back in the 50s. And here you have, John said it exactly right. You rarely see a race in Arkansas where it's national issues. Now, we did back when civil rights was the main issue of the day, and several tried to grab a hold of that issue. And Faubus was the one that was most successful, but you had others that tried to use that mantle. You know, one thing that's interesting about Sarah Sanders' opening statement was this talk about the radical left. And I've been around Democratic politics a long time, and I think you could put the radical left in a small room at the state capitol, and it would probably look like a closet. There are just not many. There are not many folks that wear that emblem around, and you can run against that all day long, but I don't think it's going to turn the tide. Although it's an issue that certainly has traction and will have traction among Arkansas voters.
Well, let me ask all three. You know, there has been mentioned a lot of discussion about the gentleman from Siloam, Mr. Senator Hendren, possibly getting in as maybe even as an independent, and appealing for Democratic crossover votes. How realistic is that? Is there room in a GOP primary, even in a general election, for a candidate such as Senator Hendren, particularly one who has seemed to move more toward the middle in a state that President Trump carried very handily? Andrew, we'll start with you.
It's going to be a challenge, and Senator Hendren has said that he's kind of moved up his timeline for a decision and plans to make one within the next 3 weeks. He certainly has been presenting himself as a centrist. He's been a lot more willing to criticize President Trump than other Republicans in the state. Has been taking on issues like the hate crimes bill, which is facing resistance from fellow Republicans. And so the idea seems to be that he's trying to find some kind of coalition of centrist Republicans and maybe Democrats who might possibly be willing to cross over and vote in a Republican primary. It definitely be a challenge. We haven't seen something like that, at least in the past recent elections. But it's definitely something where he's trying to test out if there is that coalition there. But if he does announce and aims for that coalition, it's going to be a challenge in a very red state like Arkansas.
Yeah, John Burris, is that workable?
Look, Senator Hendren's a smart guy. I think then he knows it's probably an uphill battle. As a Republican who's been a little bit conflicted over the years with President Trump and the style, I think a lot of people are ready to move on. I think Trumpism is more about a tone than it is a policy. And so when you talk about center or not center, to me, it's more about tone and approach. And I think even those who supported or worked with President Trump, deep down or inside know that it's time to move on from how we approach conservative ideas and how we talk about them. And so I would think if Senator Hendren pulls a trigger, that's probably what it's a lot about. How as conservatives we send out our message. And so it's hard to run without a party affiliation. That's common sense. And so I think if he makes the decision to do so, it's going to be because he thinks he can present a different tone, more than distinguish himself on any certain policies. Well, that's a little bit of conjecture, but that's how I view the debate.
Well, let me throw this out there, and with all due respect to every other candidate, we have all been hearing. I haven't seen any hard numbers, but for weeks we've been hearing about surveys. All of us have, which indicate this race, this primary, is Miss Sanders to lose. John Burris, you concur with that?
You'd have to think so. It's a name ID. It's a it's a name ID thing at this point. Not to mention she's going to be able to raise millions. I just think she's the clubhouse leader out of the gate. I don't think anybody would dispute that. It is a long primary. I think the national dynamic of how Republicans move on from the president and how the president handles being moved on from really affect the perception of the electorate at large. And we're talking a race that's over a year away. And so a lot can change. No doubt today she's coming at it the strongest out of those that are talking about it or already in.
Yeah, Ark Monroe, you and I can remember when $1 million was real money.
I remember when Dale Bumpers thought he had $50,000. He was the strongest candidate in the field. I think her money advantage is going to be huge. Her relationship with Trump is going to be a big deal here. He still sells in Arkansas, and we can't deny that. One of the things, though, that I think about talking about Senator Hendren, and I don't want to say too much in his favor, or he'd probably flinch because of my relationship being a Democrat. I don't want to hurt him more than help him. But he has grown in the job more than anybody I have seen recently. I worked with him when he was in the House, and I worked with him in the Senate, and he has done an outstanding job. He could get into a crowded field. It's going to take more than just him. It's going to take, I think I go back to this race in 1970, where you have 7 or 8 people in there, and over a long haul, as John was pointing out, sometimes the more reasonable the tone of the candidacy can emerge. That's clearly what happened to Dale Bumpers. And it was the tone. It started out that, hey, it was kind of Hayes McClurkin's to win back then. I don't want to sound like I'm 1,000 years old, but these are names that were important, and those races change, and they can be very fluid. And again, when Faubus jumped in that race in 1970, everybody thought it was his to lose. Now, I'm not saying Sarah Huckabee Sanders is Orville Faubus, but I think it's who's the leader out of the gate does not necessarily end up being the leader at the end of the day.
Okay, got a few minutes remaining, and I want to go back to the incumbent administration anyway. Andrew DeMillo, it's been a frustrating week for the incumbent governor in terms of getting his staff paid.
Yeah, that's correct. Relatively minor spending bill for legislative liaison for the governor's office got hung up in the state senate for a few days, and this really kind of seems to be kind of either a warning shot or kind of a sign of what's to come in this session. If he's having trouble with getting this through. What's going to happen when we get the more controversial measures through? He has a hate crimes measure that he supports, some tax cuts that are part of his agenda, and also Medicaid expansion, which every single year has a chance of blowing up into a big fight. So I think this was kind of the early warning sign, especially from some opponents of his on the right in the Senate, of where things are going to go this session.
Yeah, John Burris, on the starboard side of the Republican caucus in the Senate, well, in the General Assembly as a whole, it's rather more to the right than it used to be. You were one of the authors of what was then the private option, now as Arkansas Works. Are you concerned for getting 75 votes in the House and 27 in the Senate?
Yeah, I'm not concerned, but I don't want to sound flippant either. I think that the administration has to get the policy right. I think that there's a new waiver that's going to be presented by the agency, by DHS, to legislators, and I think it has to be sold. I don't think you can take it for granted. And what was passed in 2013 was really the start of what we all hope to be a process. You can offer low-income coverage, coverage to low-income Arkansans in an affordable way, but only if you get the policy right and if you keep making progress. So I think that they've got to pitch it. And I think that if they do, then it can pass again. But so much of what's going on right now is personality conflicts, and that always happens. It's not so much, I say it again, it's not so much about a policy. A lot of times it's about other things. And, I hope that the legislature and the governor can work through it, because there's a lot at stake. We're Republicans. We're supposed to be cutting taxes and reforming Medicaid and reforming boards and commissions and things like that. And all this other stuff, all the food fights can distract from that.
Ark Monroe, you lobbied, as it were. You served as a part-time legislative assistant to 4 Democratic governors. So you've got a little bit of experience with the tension between the executive and the legislative that can arise.
Well, that's right. And what happens when you have, and back in those days, it was primarily Democrats that ran the legislature, that have the same margins that the Republicans do today. And there's always a faction it kind of becomes a personality fight within the party. And these are not unusual. They've happened time after time. And so this skirmish this week is indicative of some of those trials and tribulations in the past. One time, back when Governor Bumpers was governor, they kicked all his maybe it's Clinton, they kicked all his legislative liaisons off the floor. They didn't have any floor privileges. And I think it was Clinton, because one of the things as a legislative liaison, you could stand behind the legislature and put your hand on his shoulder while he was voting. And that sometimes had a good effect. Sometimes it didn't. But when they did that, and that was they were just mad at Clinton at the time and just wanted to show him who was still boss. And this goes on. I hope doesn't evolve, as John Anthony said, I hope it doesn't evolve into something worse than that, because what's proposed on the table right now are some fairly contentious issues, and people have strong opinions about them.
All right. Gentlemen, thanks very much for your contributions. Thanks for coming in. We got to cut it off because we're out of time, but come back soon. We'll be right back. And we are back, and now to COVID. To some extent, the numbers tell the story. How many Arkansans infected, how many hospitalized, how many recoveries, how many deaths. But now, how many doses of vaccine are available, to whom and when and where? That and the outlook. We're joined by Colonel Robert Ator, detailed from the State Economic Development Agency to oversee vaccine deployment in Arkansas, detailed by the governor, and Dr. Jennifer Dillaha, epidemiologist with the Arkansas Department of Health. Dr. Jennifer, let me begin with you, because as of mid-morning Friday, there is some breaking news encouraging. Johnson & Johnson reports that its vaccine, its one-shot vaccine, is in its telling 66% effective. As far as epidemiologists are concerned, is that good enough?
It is good enough. The FDA had set a lower limit of what they would authorize, would be 50% effective. So we're very hopeful that this vaccine will be able to be added to our arsenal of the vaccines that we can deploy around the state. We also know that Johnson & Johnson is doing an additional phase 3 trial to look at 2 doses to see if that would raise the efficacy overall.
Well, as far as the 1 dose, this initial burst of good news from J&J, any indication that you have, doctor, as to how long it will take that particular vaccine to get out into the field?
I would say it would be within weeks. Just like with the previous vaccines that were authorized, they were able to get the data to the FDA. The FDA set up a team of people who work 24/7 to analyze the data, because they analyze the data themselves. They just don't accept what the pharmaceutical companies give them. And so they will be analyzing the data, and I think we could have a decision in February sometime.
Colonel Ator, over to you. There has been enormous confusion over the supply chain of vaccine, who gets it, where it's delivered, when they can get it, what age groups, whatever. Can you give us an update as to exactly where that stands now?
Sure. The biggest problem that we have is really the supply. And because of the supply was so constricted, and we were operating in the 1A population, which is really just, healthcare workers and first responders, that it was a very, very linear problem. One of the first things we wanted to do was to try and move out into the 1B population to create more opportunity to make sure that we're being efficient with the vaccine that we had. What we've been working on since then is trying to really 3 lines of effort. The first one being that we wanted to make maximum use of whatever supply we do currently have. The second one is to increase the supply in any way that we can. And the third one is to get into a predictive model so that we can make sure every Arkansan knows where the vaccine is and they can plan against it. That will allow us an opportunity to make sure that we can communicate that, and so we can give that little light at the end of the tunnel that allows them to know that the help is on the way. But at the end of the day, it really is, we have such tight supply that it's going to take some time to work through, and everyone just needs to be patient. I promise you, we're going to come to you.
Well, at least, Colonel, has at least the supply line, has it stabilized, or is it more stable than it was, say, a couple of 3-4 weeks ago?
Well, really, honestly, we really haven't seen that much of a change in the actual supply. We've been getting on the order of about 37,000 doses into the state each week, and that really hasn't vacillated, since the program started in December. Just this week, we saw that we had about a 16% increase in the supply coming into the state, and that we ordered against this week, and so we will see that delivery starting early next week. But that was all in the Moderna vaccine. So a lot of what we're trying to do is get a predictive model out there so we know in the hospitals and the pharmacies and the providers that are actually, administering the vaccine, they know what to expect of what they're going to get so that they can start scheduling appointments and then also just communicate with our population about, hey, look, here's what you can expect and how long it's going to take. And there
has been concern, sir, for the delivery of the vaccine into rural Arkansas. Can you update us on that? How does that stand now?
Yes, sir. When we were coming out of the 1A population, that was really, our healthcare systems and really, if you looked at the state by population of what was vaccinated, it was really kind of concentrated in central Arkansas and northwest Arkansas. And that makes absolute sense. That's where our major medical systems reside. When we got into the 1B population, then you start looking around at how we had been dispersing the vaccine, and it was a chance for us to be able to try and raise the boat for everybody. So one of the things we're letting demographics lead the discussion about where we need to target. And so we're looking at where the 70+ populations live. We're looking at where the educators are. And that's the target demographic we're working at. But also we're looking at what counties have been underrepresented by way of vaccine, and we're working to try and remedy that.
Over to Dr. Dillaha, back to Dr. Dillaha. The news about variants from Brazil, from South Africa especially. It's pretty chilling news. As an epidemiologist, your reaction to this, your sense of where this thing is headed now?
Well, this virus does mutate, and there's multiple variants circulating right now. Most of them have no effect on how the body fights the illness or how well the vaccine works. But some of them do, and the ones that we're following out of the United Kingdom, Brazil, South Africa, those variants appear to be able to infect people more readily. So they're more transmissible, and they can easily become the dominant variant in a geographic location. So it's going to be really important to control the spread of those variants if at all possible. We have some evidence now that the variant out of UK may actually increase the death rate. At first, they didn't think that that was the case, but it's now possible. So it's going to be really important to do whatever we can to prevent the introduction of those strains in Arkansas if they're not here already. We are looking for it, and we'll let people know if it is here. But the big concern is, will the vaccines protect against these variants? So far, it looks good that the Pfizer and the Moderna will still have good protection against them. And if they find that the protection is less than we want it to be, then it will be possible to adjust those vaccines so that it does better cover these variants.
And with just a few seconds remaining, Doctor, your colleagues at UAMS, their models are pretty forbidding. We are anything but out of the woods.
This is very true. Our rates of cases and deaths are coming down, but we are not out of the woods. We cannot let up at this point. We still must wear our masks, practice social distancing, avoid crowds, and wash our hands often. If we can do that, plus vaccinate people as quickly and as fully as possible, then that will give us a fighting chance to do well this spring, and then we can look at what the summer will hold.
All right, Dr. Dillaha, Colonel Ator, thank you both very much for being part of the broadcast. Come back soon. And that's it for us for this week. Thanks for joining us. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.